Hello, everyone. Welcome back to Microbiology series. Yesterday, we have discussed about exotoxins, endotoxins, their differentiating points, high yield points related to exam point of view. We have also discussed certain examples of bacteria that produce exotoxins and their mechanism of actions. Um, and in my last video, I've also covered hemolytic uremic syndrome, very high yield topic for step 1 and step 2. And today we will continue. Again, we will continue with the examples of bacteria that produces exotoxins and how they cause pathology in our body. So first, we have discussed Corynebacterium diphtheria already. We've talked about Pseudomonas aeruginosa, Shigella, and enterohemorrhagic E. coli that produces Shiga toxin. Today, we will discuss those bacteria that produces certain toxins, and those toxins increase fluid secretion. So, the examples of bacteria that increase fluid secretion are enterotoxicogenic E. coli, Bacillus anthracis, and Vibrio cholera. So, first, in the last lecture, we have already discussed enterohemorrhagic E. coli. Again, um, for revision point of view, there are I think 5 types of E. coli we'll discuss today. So first, we have already talked about enterohemorrhagic E. coli that produces Shiga toxin, and that Shiga toxin inactivates 60S ribosome by removing adenine from the ribosomal RNA. It damages GI mucosa, causes dysentery, and then eventually these toxins damages endothelium of the kidney vessels and lead to hemolytic uremic syndrome. Um, Today we are starting with enterotoxicogenic E. coli, another type of E. coli. And enterotoxicogenic E. coli produces 2 types of toxins. The first is heat labile toxin, and the second is heat stable toxin. Heat labile toxin, what is the mechanism of action of heat labile toxin? How it works? Heat labile toxin overactivates adenylate cyclase enzyme, and eventually it leads to increased cyclic AMP. Increased cyclic AMP leads to increased chloride ion secretion in the gut, and that chloride ion then drags water into the gut, so it causes water efflux. Heat enterotoxicogenic E. coli causes watery diarrhea. Heat stable toxin also it overactivates guanylate cyclase, increase cyclic GMP, eventually decrease reabsorption of sodium chloride ions in the gut. Sodium chloride ions and water in the gut leads to watery diarrhea. So what you should remember from exam point of view is that enterotoxicogenic E. coli produces 2 types of toxins: heat labile toxin and heat stable toxin. The heat labile toxin has a different mechanism of action, while toxin has also heat stable and heat labile toxin has different mechanism of actions, but they cause same disease. They both enterotoxicogenic E. coli causes watery diarrhea by two different enterotoxins, by two different toxins: heat labile and heat stable toxin. Here is for memorization, is a very good example: labile in the air, um, heat labile toxin, increased cyclic AMP, labile in the air, AA, and heat stable toxin, stable on the ground. Heat stable toxin overactivates guanylate cyclase, increased cyclic GMP. Okay, so heat labile and heat stable toxin both causing watery diarrhea. Um, Also, we call it traveler's diarrhea. Okay, now Bacillus anthracis. Bacillus anthracis produces toxin called anthrax toxin, um, and it is a gram-negative cocobacillus. Bacillus anthracis produces anthrax toxin, and it mimics adenylate cyclase, increased cyclic AMP. So it is responsible for what is the disease it causes? It causes anthrax, cutaneous anthrax, and I think there is another type of pulmonary anthrax. We'll talk about anthrax later on, likely responsible for characteristic edematous borders of black eschar in cutaneous anthrax. So, Bacillus anthracis causes cutaneous anthrax. Vibrio cholera produces cholera toxin, and it overactivates adenylate cyclase, again increases cyclic AMP by permanently activating GS protein. It causes voluminous rice water diarrhea. So you should remember, for exam point of view, that enterohemorrhagic E. coli produces Shiga toxin, very important, and causes dysentery and then eventually hemolytic uremic syndrome by 0157H7 strain of E. coli. Enterotoxicogenic E. coli produces heat labile, heat stable toxin, and causes watery diarrhea or traveler's diarrhea. Vibrio cholera produces cholera toxin and causes voluminous rice water diarrhea. Okay. Now we'll also talk about um, now let's talk about so this is very important. Types of E. coli. I thought that we have already discussed enterohemorrhagic E. coli and enterotoxicogenic E. coli, so we should cover all types of E. coli and the virulence factors they produce and the type of diseases they cause. So, E. coli, you should always remember it is a gram negative indole positive rod. We will talk about the classification of bacteria, eventually gram positive, gram negative bacteria, and we'll also cover gram positive cocci, bacilli, and then spiroche. I mean, filamentous gram positive bacteria. We'll also cover gram negative bacteria. So always remember, E. coli is a gram negative rod. It's not a cocci. It's a rod shaped gram negative bacteria. E. coli produces many types of virulence factors. Sorry, so first you should remember is fimbriae is a virulence factor. Number one virulence factor is fimbriae, and it produces cystitis, causes um, uh, cystitis, which is an inflammation of the bladder, infection of the bladder, and pyelonephritis, infection of the kidney, UTI. So in simple words, first important virulence factor of E. coli is fimbriae, and through this virulence factor, it causes cystitis and pyelonephritis. So how fimbriae, it allows the addition of bacteria to the uroepithelium, and that's how it causes UTI. Always remember, the most common cause of UTI is E. coli. Always remember, and also in the sexually active woman, the most common cause of E. coli is most common cause of UTI is E. coli. Now, second virulence factor is K1 capsular polysaccharide. K1 capsular polysaccharide prevents phagocytosis and complement mediated lysis, and it leads to neonatal meningitis and pneumonia. Third type of toxin you guys should remember is lipopolysaccharide. What lipopolysaccharide do is it activates macrophages. Eventually it releases interleukin 1, interleukin 6, and TNF alpha. We have already talked about these pro-inflammatory cytokines yesterday in my first microbiology lecture, so you guys should go and um, watch that video. So lipopolysaccharide produces interleukin 1, 6, TNF alpha, and it causes bacteremia and eventually septic shock. We have talked about enterotoxicogenic E. coli already. Enteroinvasive E. coli, it invades the intestinal mucosa and causes necrosis and inflammation, and it causes invasive E. coli, so it causes dysentery, similar to Shigella that produces Shiga toxin. Enterotoxicogenic E. coli, we talked about heat labile, heat stable toxin, no invasion, no inflammation. That's why they're not causing bloody diarrhea or dysentery. They're only causing simple watery diarrhea, which is traveler's diarrhea. Enteropathogenic E. coli, they don't produce any type of toxin. They adheres to apical surface, flattens villi, prevents absorption, and from Pathogenic, always remember um, P for pathogenic and P for pediatric. So it causes pediatric diarrhea, usually causes diarrhea in children. Enterohemorrhagic E. coli O157H7, most common serotype in the US. We have talked about that it is transmitted through undercooked meat or unpasteurized milk products, and it causes dysentery, and then eventually it causes hemolytic uremic syndrome. We have talked about that already yesterday. Yeah, so now let's talk about Bordetella pertussis that causes pertussis whooping cough. Bordetella pertussis is a gram-negative aerobic cocobacillus. E. coli was a bacilli, was rot. Sorry, Bordetella pertussis is cocobacillus. So, Bordetella pertussis is a non-invasive pathogen, but it has several virulence factors like pili, filamentous hemagglutinin, protectin. These are the virulence factors of Bordetella pertussis, and that allows it to strongly attach to respiratory epithelium. And when it attaches to respiratory epithelium, after binding, it releases inflammatory and exotoxins. And those exotoxins include pertussis toxin that disables GI protein. Also, pertussis toxin is also known as AB toxin. It also releases adenylate cyclase toxin that increases cyclic AMP, and tracheal cytotoxin. So, pili, filamentous hemagglutinin, and protectin, these are the virulence factors that attaches to the respiratory epithelium. And once they get attached, they release inflammatory exotoxins. And these are the three inflammatory exotoxins you guys should remember: pertussis toxin, adenylate cyclase toxin, and tracheal cytotoxin. What they do, the disease has three clinical stages. First, the patient will have, in first 1 to 2 weeks, the patient usually have catarrhal stage. That is more likely upper respiratory tract infection. Patients will have low grade fever, cough, coryza. They have coryza like runny nose, and then there is the second stage is paroxysmal stage that stays from 2 to 6 weeks, and a paroxysmal stage is characterized by um, inspiratory whoop and expiratory coughing. So, paroxysms of intense cough followed by inspiratory whoop. And in adult patients, they usually have post-tussive emesis, post-tussive vomiting, which is after paroxysm, after whooping, there is an episode of vomiting. Um, then the third stage is convalescent stage, which stays for weeks to months, and the patient usually gradually recovers there is a gradual recovery from chronic cough in convalescent stage. How can we prevent Bordetella pertussis? We can prevent it by the vaccination, which is Tdap, Dtap. Tdap is tetanus, diphtheria, and acellular pertussis vaccines. um, DTaP is usually for the children, and TTAP is for the adults. Um, the important point which you guys should remember is lymphocytosis is an important finding in this infection. And usually, lymphocytosis is uncommon in most bacterial infections, but here in Bordetella pertussis, in pertussis, lymphocytosis is a significant finding. Chest X-rays are usually unremarkable in Bordetella pertussis. How we treat Bordetella pertussis: we give patients macrolides like azithromycin, and if the patient is allergic to macrolides, we give them TMP SMX, trimethoprim sulfamethoxazole. Um, So we have talked about E. coli and their types. We have already talked about Bordetella pertussis in detail. That there are three toxins you guys should remember: pertussis toxin, adenylate cyclase toxin, and what else? Tracheal cytotoxin. They activate adenyl cyclase, increase cyclic AMP by inactivating inhibitory subunit. By inhibiting GI subunit, they cause whooping cough, coughing episodes on expiration, and on inspiration there is whoops and can cause 100-day cough in adults. It is associated with post-tussive MSS. Now, the last topic is we'll talk about Clostridium bacteria that inhibit the release of neurotransmitter. That includes Clostridium tetani, Clostridium botulinum, these two. But today I will focus on Clostridium tetani. In the next lecture, we will cover Clostridium botulinum. So, Clostridium tetani produces important toxin. This is very important from exam point of view, that Clostridium tetani produces a toxin called tetanospasmin. And so Clostridium tetani is a non-invasive pathogen. Okay. And it is a non-invasive pathogen. It stays how we get tetanus. We get tetanus through puncture wound. Okay, any nail can puncture your skin. So Clostridium tetani is a non-invasive pathogen. It stays localized at the wound site. The pathogen stays at the wound site, but the toxin, the tetanospasmin toxin, enters the presynaptic terminals of lower motor neurons, and it travels by retrograde transport. And it travels by the retrograde axonal transport to the CNS. And in the spinal cord, through the retrograde transport in the spinal cord at the level of anterior horn cells, the toxin blocks the release of inhibitory neurotransmitters, leading to and it causes spasmodic muscle contraction. So what happens is, the pathogen stays in at the wound site, but the tetanospasmin toxin enters the presynaptic terminal, and through retrograde axonal transport it enters into the CNS. What happens is, so you guys should see this image. What happens is, what tetanospasmin do is, tetanospasmin is a protease. Is a protease. That means it breaks down the protein. So tetanospasmin is a protease, and it cleaves snare protein. What is snare protein? Is a soluble NSF attachment receptor protein. It cleaves that protein, and that protein is required for the neurotransmitter. Which neurotransmitter? Glycine and GABA. These are the two inhibitory neurotransmitters that need that this snare protein. To Neurotransmitters need this snare protein to release from the presynaptic terminal into the synapse. Um, this image will help you understand more. Um, so yeah. So what happens? Skin wound with Clostridium tetani growth. Okay, there's a skin wound. Um, Clostridium tetani is here, but the um, tetanospasmin enters through the retrograde transport into the CNS. So here, through the retrograde transport, here the tetanospasmin is entering, and through the retrograde transport, it is entering into the CNS. What happens in the CNS? This is the presynaptic terminal, and this is it enters into the CNS. Okay, so what happens is, this is the presynaptic terminal, and this is a postsynaptic terminal, and this is synapse. So what happens is, glycine and GABA, these two are the inhibitory neurotransmitters that inhibit muscle contraction. Okay, and these glycine and GABA neurotransmitters are present in a protein called snare protein. Okay, what happens is, this look this tetanospasmin is entering into the presynaptic terminal, and it is inhibiting this snare protein. This snare protein is taking glycine and GABA neurotransmitters to the synaptic cleft. here. But what happens is when tetanospasmin enters into the presynaptic terminal, it inhibits snare protein, it cleaves snare proteins, it is preventing snare protein from its work. So what happens is, these neurotransmitters cannot enter into the synaptic terminal. These neurotransmitters cannot get released into the synapse here. Um, because tetanospasmin is inhibiting snare protein. So when glycine and GABA are not released into the neurotransmitter, what happens is motor neuron is not inhibited, and when motor neuron is not inhibited, muscle contract aggressively. There is no inhibition to the muscle contraction, and there will be excessive muscle contraction that increase muscle tone and leads to muscle spasm. So this is a very important pathophysiology you guys should know. And this is another view. No, that is from the bottom. Okay, so what happens, we have talked about this, and then what happens is tetanoplasmin prevents the release of inhibitory neurotransmitters glycine GABA. Always remember, from Rancher cells in the spinal cord, and that lead to spastic paralysis. So important clinical findings we see in patients of tetanus includes: number one is spastic paralysis. Spastic paralysis means muscle stays tightly contracted. There will be muscle spasms. The second finding is trismus, which is also called locked jaw. That means jaw muscles are stiff. There will be jaw stiffness that leads to difficulty opening mouth. Um, Third important finding is rhizus sardonicus, and rhizus sardonicus means there is a spasm of facial muscle spasm. Fourth important finding is opisthotonus. There is severe back muscle spasm. Okay, so these are the important findings you guys should remember from for tetanus. And then how can we prevent tetanus? Prevention of tetanus is through vaccine, obviously. And which vaccines? Um, we have talked about Tdap, DTaP vaccine, tetanus vaccine, which is a toxoid vaccine. We have already talked about the toxoid vaccines in the previous lecture. And how can we treat? What are the treatment options for tetanus? So for treatment options are obviously antitoxin, and then vaccine booster, and antibiotics. And for muscle spasm, the good option is diazepam. And obviously the first most is wound debridement. Cleaning of the wound is very important. So this is the explanation of Clostridium tetani, and we have talked about tetanus. We have covered everything. We have covered all high yield points related to Clostridium tetani. So if you guys have any questions, you can ask me in the comment section. Thank you so much.